Today we will discuss about GIT drugs of disease gastroesophageal reflex disease. A brief review about gastroesophageal reflex disease. So it's a condition in which stomach acids flow back into the esophagus that can cause symptoms like heartburn, chest pain, and also difficulties in swelling. So it can be managed through lifestyle changes such as avoiding trigger foods, eating smaller meals, and losing weight if necessary. So medications that can be used as antacids, H2 blockers specifically, and proton pump inhibitors. As we know, in previous videos we have discussed about H2 blockers, proton pump inhibitors, and antacids. So in this video I will not discuss about this. Today in this video I will discuss sodium alginate and prokinetic drugs. This 5 category, which is proton pump inhibitor, H2 blockers, antacids, sodium alginate, and prokinetic drugs for the treatment of gastroesophageal reflex disease. So I will briefly discuss about only these two in this video, sodium alginate and prokinetic drug. So let's discuss about sodium alginate. It's basically a natural product, and it is extracted from brown seaweed, which is an algae, and it's a natural polysaccharide that is present in the cell wall. So it is mainly used for the thickener, as a thickener and emulsification for some food product, and mainly used in pharmaceutical companies for their product and suspensions. The mode of function of sodium alginate is in a disease of gastroesophageal reflex disease, as when a reflux of the gastric content to the esophagus can cause irritation to the esophagus. So when we take this drug, it works by forming a protective layer over the stomach content, and it helps to prevent the acid reflux and from heartburning. So sodium alginate is also used in other pharmaceutical purposes like wound dressing, and also as a drug delivery system in pharmaceutical companies. So the sodium alginate is available in the form of liquid and tablet form, such as Gaviscon. It contains sodium alginate.
The fifth class of drug is prokinetic drugs. These drugs is basically used to increase the motility and to increase the emptying of the stomach. So it have function by increasing the peristalsis movement, and it also increase relaxation of the pylorus end, and it also increase the tone of the lower esophagus sphincter. So as a result of which it will oppose the gastric reflux. The drugs that include in prokinetics are metoclopramide and domperidone. These two are the specific and effective drugs. These tablets available in tablet form and also in IV form. So in tablet form it can give 10 milligram, and in IV form we can give 10 milligram per 5 ml. Some adverse effect has been reported like bloating, diarrhea, and constipation while consuming large amount of sodium alginate, but it is safe for consumption and usage in pharmaceutical purposes. Other adverse effect like allergic reaction of sodium alginate also has been reported. Side effect of prokinetic drug include like diarrhea, vomiting, abdominal cramps, and sometimes cardiac arrhythmias. Other drugs that we can also use like H2 blockers that include cimetidine, ranitidine, roxetidine, and famotidine. Proton pump inhibitors that include omeprazole, esomeprazole, lansoprazole, this type of drugs, and antacids like sodium bicarbonate, magnesium hydroxide, aluminum hydroxide, megaldrate, and magnesium carbonates. These drugs can also be used